This is such an important topic that everybody understands what I'm talking about, but no one wants to acknowledge. Everybody wants to pretend that for some reason they have evaded the issues and they are fine. But intuitively, a lot of people are struggling with brain fog. They won't tell you. Oftentimes, I only know it when I talk to patients clinically, and this is something that therefore they struggle with. But the reality is that very often they don't want anybody to know. This is a real issue. And so it will be affecting them at work. It will be affecting them at home. It will be affecting them in multiple situations. But because of the implications in the context even of work or with family, they don't tell anyone and they suffer in silence. So if you are one of those people, there are things we can do. It's not easy, but it can be done. What I'm referring to is a very important study that came out earlier in the year. And this study here was looking at cognition and memory in a large community sample, looking at the disease here in terms of COVID 19. It was published in February 28, 2024. The reason it had been drawn to my attention was because somehow this article was then published. Don't be stupid. Skipping your COVID booster could reduce your IQ. This was in the LA Times. And effectively, somehow they were using this study to highlight the fact that there seemed to be a tiny risk reduction in people who had been vaccinated, and therefore they were worried about the nation's vaccination effect failing. This was on the 14th of October. Only 22% received their COVID booster. And in effect, they're trying to say if you get boosted, you will reduce your risk of cognitive issues. And at the very end of the article, it says it's smart to be vaccinated. Of course, that's why more than 95% of a group that knows COVID better than most physicians got their shots. They've thrown the physicians under the bus there with that. But the reality is that they, I think, were using that paper to promote vaccination. It should remind them that vaccination doesn't really impact on infection, and in some cases, there is negative efficacy in some studies. So you would think that it increases the risk for some cohorts. And so the bigger question is what happens when COVID breaks through that mucosal immune barrier? That's the bigger thing. That's really what I'm talking about here. And what I want to tell people is that it's not that there is absolutely nothing you can do. And this is right within my focus. For anyone who knew what I was focused on prior to COVID, was that had taken apart dementia. I had gone deep, broken out all the mechanisms. And just as COVID hit, that was when I was going to explain all of the approaches that could be used with dementia. When COVID hit, I realized I had to reformat the research. And this is why I've been focused on COVID for such a long time. The reality, though, is that it really complicates what we can do. And so you have to think ahead that you have to protect your brain at the end of the day. One of the things that I've done with regards to that, and you click on the link below, is talking about the four pillars against the COVID storm, spike triggered autoimmune response mechanism. This is a concept that I'm pushing forward as what is likely to happen with reinfection. And if you join us with that, you'll also get access to the storm video. I've put together a whole program on it, and so you'll get the first module free if you sign up, and I'll be able to update you with some of the strategies that I think quite simply can make a difference. But getting back to the paper, the bigger issue is what in the world is going on. So when they looked at the paper here, they knew that there were cognitive symptoms after COVID, and they were looking at it because of it was severe disease. But actually, they thought, well, is it actually just severe disease? So they were looking at about 800,000 adults in the UK. They got them to do a number of cognitive scores across 8 tasks, looking at people who had persistent symptoms as well, lasting 12 weeks after infection. That's the long COVID type of picture. And of this, that they had 141,000 participants who did the online cognitive assessments and completed it. So this was quite a big study. This is excellent work that was done looking at the cognitive patterns that were in place. And when you look at the timing for this here, and I'll show you again, this was done in England from the 1st of May 2020 to March 31st, 2022. So it covered including the Delta variant as well and the Omicron variant for only a few months in up to March 2022. Because remember, Omicron appeared around December of 2021. And so I think that's part of the problem because in truth, Omicron eh, Omicron was just not as severe in terms of causing severe illness, certainly in the unvaccinated cohort. It still caused problems in the vaccinated cohort because it evaded their immune system. And I think that part of the issue is that it may not have been as significant if they had continued to do that research for maybe another year. And so, one of the problems with the pandemic is that every time you do research, because of the transitions, you have to be so careful about thinking you can extrapolate the research that you did early in the pandemic to what is happening now. Omicron is a different beast. It operates differently. It enters the cells differently. It tends to have a predilection for different organs. It certainly seems to cause more neurological issues and sometimes heart issues. It doesn't cause as much respiratory issues. That's just because of where it infects, usually in the upper in the bronchioles and so on, not going all the way down into the lungs. So these characteristics change the way that Omicron operates. But the point being is that COVID overall seems to be having a significant impact on brain function. And here's what's really interesting because they did 6 cohorts of people. Now take a look at this here just to understand. So when they looked at the illness duration, they had 6 cohorts. One cohort had no COVID, and when they say no COVID, what I think they mean they were exposed to COVID, but they didn't actually have a significant infection. That's the baseline. Then you have the asymptomatic group, which you would think are the same, not necessarily. These people had a positive test, but didn't have significant symptoms, or they were asymptomatic largely. Then there were people who had 4 weeks of symptoms, 4 to 12 weeks of symptoms, greater than 12 weeks resolved, and greater than 12 weeks unresolved. And what you can see here is that in terms of the deterioration in cognitive score, this is the baseline here, even asymptomatic infection caused an impact on cognitive function. The most significant impact, of course, is people who are having ongoing symptoms after 12 weeks, which makes perfect sense. But this is just to highlight the point. There are a lot of people who underestimate COVID. And I keep on seeing people talking about this is just a flu or a cold. And I just remind you that we haven't yet agreed as to exactly where it came from. And there's a real possibility it came from a lab. And if it came from a lab, it was not designed to be just like a typical virus. And this is what we're finding. So underestimate it at your peril because this beast is just keeps on going. We're 2024, all the 4 years down the line, and we are likely to still be facing many issues with it. So the big question is not whether or not COVID is a storm in a teacup, is how in the world do you protect yourself from it? That is the bigger question that I think people need to address. There's another bit that I wanted to highlight from this here before I explain to you what I think is happening. And this was from the supplementary report of the paper. And it was just looking at, for people who had ongoing persistent COVID cases, the cognitive scores between those indicating the presence or minus of individual symptoms within 2 weeks of the testing. And what is fascinating here is that, so the further down it is, the worse the cognitive score. And you can see the worst performing people had severe fatigue, inability to even get out of bed. Next in line, people who had persistent fever. This doesn't sound like COVID. It sounds as though it's complicated by something else, because ongoing fever is not usually a pattern. Here we have another cohort who had numbness or tingling. This suggests neurological involvement, and so therefore it's not surprising that they had cognitive deficits. Similarly, dizziness. Chest pain, remarkably, was included as being relatively high. And here we have poor memory, mood swings, and anxiety. All of this group were performing badly on their cognitive scores as well. So, this is very significant. It points to the fact that if you have neurological symptoms, there's a stronger possibility that you could have cognitive impairment. Now, as I said, a lot of people are struggling with this, but they don't want to tell you. And I understand that, because everybody's going to be panicked about it, and they'll say maybe you're getting dementia. It's not like that. It's really, and I'll give you a few ideas as to what I think is going on. And critically, I do think that there are strategies that we can use to impact on it. Maybe, and it's not the brain that we need to target. And very often we have to target the gut, but that's a whole different education. And so make sure, if you're interested, you sign up for Storm so that you can get more information about that. But taking you through the basics again, the principle with no COVID is that if you had no COVID, because everybody's exposed, it means your mucosal immune system blocked it right at the start. It couldn't get through the gate. And so, therefore, you wouldn't have any symptoms at all, and therefore, no damage to cognitive scores, which makes perfect sense. And there are a lot of people who talk about it all the time. They have never had COVID. They're good. That's good. They have good mucosal immunity. And the only advice is that your mucosal immunity is not perfect. And so, therefore, there are times when it can fall off. And so, you still have to be cautious with regards to exposure. But where the real problem comes is the fact that once the virus breaks through this mucosal barrier, this is what this black line is supposed to mean, and it gets into the systemic circulation, it starts to trigger immune responses that can lead to the problems that are occurring with regards to COVID. And this is why I said, so this is why even what appears to be mild COVID, it causes symptoms, because it's triggering immune responses. And it's the immune responses that seem to be driving a lot of the pathology. So here is what I predict happens for quite a few people, is that once it breaks the mucosal barrier, virus then starts to circulate, it replicates in endothelial cells. That's where the problem comes. And the longer it takes to resolve this, the more likely it is that there's going to be issues, certainly with the brain, not just with the brain, but that's the characteristic that I expect with regards to the COVID storm. When the virus starts circulating in the bloodstream and triggering the immune system, it will then cause lots of problems. But specifically in the brain, it will cause inflammation. And this is the driver. And this is just an example of a brain, looking at it from the front. This is the brain stem, and it's red around it just to represent the fact that there is inflammation ongoing even after the infection has resolved. That's part of the problem, is that because it triggers these immune responses, they don't disappear quickly. So to put it in context, there's a condition we call a reactive arthritis. So somebody, or even a reactive pericarditis to, say, a viral infection before COVID, somebody gets unwell, and then they get joint pains or they get inflammation around the heart after they had a viral infection. We usually tell them, don't worry, just take the pain relief. It will resolve in about 4 weeks. And that's largely because it takes about 3 to 4 weeks for your immune system to switch off. Infection has cleared, immune system then switches off. So once the system switches off, you come back to normal. What's happening with long COVID is that there are some people who don't switch off, and that immune driver continues to cause inflammation, not just in the brain, but in other organs. And this is what it could look like. And see, you have here, this is the brain. This is where it's neuroprotected. It's producing lots of neurotrophic growth factors, protecting the neurons. You have the microglia. These are the immune cells in the brain. They're producing anti-inflammatory substances, and they're doing their work. Everything is going fine. Then you can imagine there is COVID. The inflammatory stimulus then triggers these microglia to produce inflammatory cytokines, which then damage the neurons. And this inflammation in the brain is one of the drivers for this brain fog. And one of the difficulties with the brain is that once the brain is inflamed, the brain is really not a part of your body. It is, because of the blood brain barrier, it's like a completely separate foreign organ. And once it gets inflammation, it has to resolve it on its own. So you have to try and support the brain in order to get it through that. And again, I remember reminding you, make sure to sign up for Storm so that you can get more information about this. Um, and so this is the characteristic that you have. One of the important things is the inflammation. The other thing that a lot of people don't understand is to do with this microclotting issue. Now, the more that we are looking at what is happening across the board, and certainly some of the research coming out, is that microclotting, that's where you have tiny little clots floating in the bloodstream, are far more prevalent than people think. And it largely is asymptomatic. Now, in people who have long COVID, oftentimes they have microclots. And so, therefore, part of the approach is to try and thin their blood to reduce the risk. But what was interesting is that a lot of people had microclotting characteristics even without symptoms. And this is important in terms of why I think brain fog will last, or these cognitive deficits. This here is demonstrating a brain. The red represents the blood vessels supplying the brain. This is the bloodstream, a capillary. This is the blood brain barrier. So this protects the brain from the rest of the body. Only what it wants can cross it. But what I've shown here is what is a microclot. And so, if these little clots are floating in the bloodstream, they can then block up blood vessels, not just in the brain, but in different parts of the body. But in the brain, if it causes reduction in blood flow, then these red blood cells, there are less of them going to that part of the brain. It may not completely block the blood flow, that would cause a stroke, but it reduces the blood flow. And because each one of these red blood cells carries oxygen, it theoretically means you can't get enough oxygen to parts of the brain. And because there isn't enough oxygen, that means the brain can't produce enough energy. And if the brain can't produce enough energy, that then leads to dysfunction in the brain, causing cognitive deficits. That's essentially the principle. So there are multiple levels. Microclotting is one. Just general inflammation that doesn't resolve is another part of the puzzle. But what we need is first to be able to acknowledge some of these strategies or some of these issues and try and come up with strategies to try and mitigate it. As I said, one of the mistakes is to think that the problem is with the brain. No, the problem is with the microclotting and the inflammatory drivers that are coming from elsewhere. Part of my approach to helping to resolve these things is to identify where the inflammatory focus is. When that is addressed, then it makes it easier to try and resolve some of these long term issues. But the main point at the end of the day is protect yourself from this virus as best as you can. Whatever you think you have to do, make sure you do it to reduce your exposure. Some people think that they can take it on no matter what. I wish them luck in the long term because, as I said, the impact of this virus is quite remarkable. So, in summary, at the end, remember, click on the Storm link if you want to watch one part of the module, and if you want more information about strategies you can use, please do that now. Also, remember to subscribe. And if you're interested in our YouTube membership, remember to do that as well, where we try and answer all the questions that you ask. So, as usual, have a great evening until we speak again.